MLT Case Study Series 30. A case study on the topic. Unraveling Hyperthyroidism, a Clinical and Diagnostic Exploration. Case Study of Graves' Disease, from Symptomatology to Management. Introduction to Hyperthyroidism. Definition: Hyperthyroidism is the clinical condition resulting from excessive thyroid hormone production. Etiology: the most common causes include Graves' disease, toxic multinodular goiter, and toxic adenoma. Other causes may include thyroiditis or excessive intake of thyroid hormone. Pathophysiology: excessive thyroid hormone production leads to an increase in metabolism, affecting various body systems. Clinical features: symptoms include weight loss, palpitations, excessive sweating, heat intolerance, tremors, and anxiety. Physical signs may include goiter, eye changes, in Graves' disease, tachycardia, and hypertension. Diagnostic approach: diagnosis is based on clinical evaluation, laboratory tests, TSH, free T4, free T3, and sometimes imaging studies or special tests like the radioactive iodine uptake test. Case study: Jane Doe. Patient presentation. History: Jane Doe, a 34-year-old female, presents with complaints of unexplained weight loss, increased appetite, palpitations, and tremors for the past 2 months. She also reports feeling more anxious and intolerant to heat. Physical examination: on examination, she has a mild tremor, an elevated heart rate, and an enlarged thyroid gland without nodularity. Her skin is warm and moist. Laboratory tests and results. Thyroid-stimulating hormone, TSH, less than 0.01 μ/L, normal range, 0.4 to 4.0 μ/L. Free thyroxine, free T4, 2.5 ing/dl, normal range, 0.9 to 1.7 ing/dl. Free triiodothyronine, free T3, 6.5 pg/ml, normal range, 2.0 to 4.4 pg/ml. Antithyroid peroxidase, anti-TPO, antibodies, positive. Antithyroglobulin antibodies, positive. Radioactive iodine uptake, RAIU, elevated uptake indicative of Graves' disease. Diagnosis. Based on the clinical presentation and laboratory findings, Jane Doe is diagnosed with hyperthyroidism, most likely secondary to Graves' disease. The suppressed TSH and elevated free T4 and free T3 levels confirm hyperthyroidism. The presence of antithyroid antibodies and elevated RAIU further supports the diagnosis of Graves' disease. Management. Management options include antithyroid medications, e.g., methimazole, propylthiouracil, radioactive iodine ablation, or surgery. The choice of treatment depends on several factors, including the severity of the disease, the presence of complications, and patient preferences. Discussion. In this case study, Jane Doe's clinical symptoms and laboratory findings are indicative of hyperthyroidism. The very low TSH level is a key indicator, as TSH is inversely related to thyroid hormone levels. The elevated levels of free T4 and free T3 confirm the diagnosis. The presence of antithyroid antibodies suggests an autoimmune etiology, which, along with the elevated RAIU, points to Graves' disease as the underlying cause. Conclusion. Graves' disease is an autoimmune disorder and the most common cause of hyperthyroidism. It is characterized by the production of antibodies that stimulate the thyroid gland to produce excess thyroid hormones. The management of hyperthyroidism aims to reduce thyroid hormone production to alleviate symptoms and prevent complications. Importance of medical lab professionals. This case study emphasizes the importance of a thorough clinical assessment and the role of specific laboratory tests in diagnosing hyperthyroidism. Medical lab technologists play a crucial role in performing and interpreting these tests, contributing to the overall management of the patient. Thank you. Please subscribe for more videos.